persons affected with PCOS also deal with hair loss. So, what causes this hair loss, and what do you recommend that we can do about it?
Okay. So female pattern hair loss, that's what happens in women. And usually there's a genetic predisposition for this. But in PCOS, it can present a little more severe. That's all. So in female pattern hair loss, what happens is the front portion is always retained, unlike in men. But the top, we notice a gradual thinning with age, the top and a little bit on the sides as well. That's how it is in women. You won't always find that you're shedding a lot of hair. It just over years, it gradually thins out. The hair becomes thin. You can see your scalp, so you feel uncomfortable. That's what they usually come to us saying. And this can happen at any age post-puberty. But the earlier it happens, the earlier it happens and the more time, before you come to treatment, the more difficult it is to get a result. Because if you delay treatment, then eventually the hair gets miniaturized. So I'll just explain what the normal hair growth cycle is. So there's a growth phase which can last a few years, 2 to 6 years usually, in which the hair is growing, it's thick. Then there's a transition phase, and then there's a resting period. So that resting phase is about 3 months, in which the hair root gets loosened, and then it will fall out eventually, it gets shed. So in female pattern hair loss, what happens eventually is miniaturization of this hair follicle. So every time it falls, the next hair that grows will be thinner and thinner and thinner because of these male hormones coming and acting over there. And again, as I said, genetically, it's affected by genetics as well. So, so this is what leads to eventual thinning.
Right. So, what are your recommendations? So, if somebody is suffering from really heavy hair loss or hair thinning, what do you recommend? And is having PCOS, what do you recommend they should do?
Okay. First, I'd examine her to check if she seems like she has anemia, because anemia is the most common cause of hair loss in women in India, at least. It's much more prevalent than we think. Yes. So very often you'll just check the lower eyelid and then you'll realize it's pale. And obviously, sure enough, the hemoglobin's around 9, which is quite low, but quite common in women. So supplementing your nutrition with vitamins and iron tablet would definitely be the first step. You'd have to get assessed again. We'd have to check the hair, because there's another type of hair fall which occurs due to stress, which is also very common in women. So a lot of women say changes in weather affect their hair fall. Sometimes they have more hair fall in winter. Usually when you have a fever, someone who has malaria, or after pregnancy you have hair fall. After drastic weight loss, you can have hair fall. A stressful schedule, maybe less sleeping hours. All these things also can cause temporary hair fall that occurs 3 months after the stressor. So that is called telogen effluvium. So sometimes it's just stress-induced hair loss. And they say, I've lost 50% of the volume of my hair. That's quite common too. That will recover in 6 months' time with just vitamin supplementation and maybe a hair lotion. Yeah. So that's very important. Usually we start with a vitamin, and we'll always use Minoxidil eventually to treat the hair loss. The percentage again depends on the severity. For women, we always start with 2% Minoxidil. And we'll instruct them according to whether they have a dry scalp or an oily scalp. So instructions will vary depending on the scalp as well. Yeah. And if they're planning to conceive, then we avoid Minoxidil. Then we give something else. There are other options as well. So that's the first step. If a lady has, maybe if she's finished, they're complete with, the family is complete, and she's not planning to conceive again, and her hair falls, the thinning is extremely severe, then we do consider another medication. It's called finasteride. But that's usually after 40 years of age. That can help a lot with a very severe hair fall. Yeah, that can help to some extent, of course.
Okay, I'm going to go back on the same question. So could you just tell us a little bit more on what vitamins you start? And I think we could use a little clarification on Minoxidil, because a lot of people, whether it's a hairspray or a hair oil, so that we know what it is.
Okay, sure. So vitamin B12 is the most important vitamin, actually. Especially, and also because there are a lot of vegetarians in our country, so vitamin B12 is definitely deficient in a large population. So you get all over the counter vitamins, they will all work. Vitamin B12, Supradine, Becosuls, they're all good. There's iron tablets, which I wouldn't recommend everyone to just take iron medication, because they can have some issues. You may have gastritis, you may end up with constipation. These are common issues, but maybe you can get your hemoglobin checked, and then you can supplement with iron tablets as well. iron and folic acid. Simple vitamins. You don't need to take specific biotin vitamins because that became a hype, but that does not really affect your hair fall. You just take vitamin B12. Biotin, there's no study that has actually shown it helps hair fall
Okay.
in people who don't have a biotin deficiency. So
Right.
that was actually
Right.
more of a hype. Yeah.
That was going to be my follow-up question because that's
Yeah,
all
yeah,
you
yeah.
heard.
Biotin,
Um,
yes, yes.
yes.
Yeah.
So, okay, biotin. And then could you just touch up on minoxidil once, please?
Yeah.
What are the formulations available?
Yeah. So minoxidil usually comes as an alcohol-based liquid. So it's not oily. It's a lotion. Yeah. It dries up. In fact, it makes your scalp a little dry as well. Okay.
Okay.
So
So,
it is available as a lotion. Like you can get it with a dropper. It's available in a spray form. They give you the spray with it. So you can spray it or you can use the dropper and apply it with your fingertips. And there was a time when we were getting foams also. But I don't think that's very popular anymore. I think it wasn't very stable. It would just disintegrate. So yeah.
are there any side effects that your patients have faced due to minoxidil?
Most common will be irritation of the scalp. So it depends on
Okay.
whether you have a dandruff problem already. So that's why it's important for us to examine your scalp or sensitive scalps. Very few patients have an allergy to the alcohol part in the minoxidil. So it will irritate your scalp, little redness, but it's about 95% of patients are completely fine. A few patients may get a headache. It may not suit you. Yeah. That's why we always start with 2%. It basically, it
Right.
stimulates the blood flow and it improves the hair growth.
Fun fact for everyone who's listening, minoxidil was actually a medicine that was started to reduce blood pressure. And this was just a side effect that was noted, which is why I think
Yeah.
they started. Am I right? Yeah.
Yeah, correct.
They started using it for hair growth.
Hair loss and hair thinning. So you should get assessed by a dermatologist to know the cause, the underlying cause. Maybe it's just a nutritional deficiency. Maybe it's a chronic stress induced hair loss, which occurs, along with your genetic predisposition to have thinning of hair, to have hair loss. Maybe you have PCOS, maybe you have some other hormonal, underlying hormonal condition. So get assessed first. And then
Right.
treatment can be simple. We can just stick to a vitamin and minoxidil lotion. That's the basic treatment. And you can continue that for a long time. Over 6 months at least, you will start noticing the changes. So it takes at least 3 months to notice a change, improvement, like your hair fall will reduce. And then the next 3 months, you will notice that the hair, it's covering the scalp. It's covering up a little more.
Right.
In a year's time, you'll feel, okay, it's improved a lot. And then there are more treatments that you can do for hair loss, but without the basics, you don't do those.
Right. I think so. The biggest thing to remember in hair loss treatments is just be patient, I
Yeah.
guess, because results are going to take time to show.
Hair quality. Okay, but the smoothness and the softness, hair texture is different from hair growth. From the
Right.
thickness of your hair. Yeah. So
Right.
that can be treated with there are hair products for that. So the shampoo, your conditioner, maybe a hair spa if you want to, using serums can help your hair quality. But the thickness of your hair, you need medical treatment for that. Yeah.
Could you give us a little bit insight into what shampoo, serums, or hair products we can use to improve hair quality?
Okay. So most of the shampoos that we get normally are good to use. Okay. You can use them in combination with a conditioner, because a conditioner is what sort of seals your cuticle. The cuticle is the outer part which protects the inner hair. Yeah, the shaft of the hair. So the cuticle is what gives you the shine. Okay, the sheen of the hair. So conditioner helps to smoothen the cuticle and preserve the cuticle, because again, with UV exposure, with aging, your hair tends to get weathered out. So that's what makes it dull and rough. So shampoo and conditioner, you can use. There are lots of serums which contain various things from mineral oils to vegetable oils, and even silicone-based leave-in conditioners and serums. They can all help.
Right.
Yeah, that's it. Nothing else that you need to do. Avoid bleaching, perming, avoid hot iron. Those things damage the cuticle. For hair growth, you don't have to oil your hair. Oil is like a conditioner. So oil again just helps to improve the cuticle. So it gives you that shine. So you can use it like a pre-wash conditioner. Don't keep it on too long, down the sides, you tend to get more pimples there. Yeah, so you're doing more harm than good. But coconut oil is the best if you want to use an oil. There's no added advantage in using Moroccan oil, any other oil really. You can just stick to coconut oil. It's the best for hair, yeah. But it's not going to improve the thickness of your hair, or it's not going to increase the speed of hair growth. That doesn't work. It doesn't go inside your scalp. It's just on top. Yeah, it's a conditioner. Yeah. Okay, vitamin B12. So tablet Supradine, Becosol Z, you can take once daily. Take it for 3 to 6 months. Again, take some time. So 3 to 6 months. And hair lotion, you should get assessed by a dermatologist. But then Minoxidil 2%, once you know how to use it, when to use it, how often to use it, then that will help for sure. But again, 3 to 6 months at least. Nothing else has to be done for your hair loss.
Are there any patients, and I'm sorry to bring it like distracted a little, but who are not ideal candidates for minoxidil? So like something that people should know before just going out there and, thinking this is it for them.
Yeah, if you're planning to conceive, if you're already pregnant, if you have allergy to minoxidil, which you've used before, like due to the alcohol component in it usually. Some people with migraines feel that they get headaches sometimes. So you have to assess that. It is a valid point as well. Yeah. Otherwise, it is safe to use. Yes. Yes. So you have to use minoxidil as long as you want your hair to improve, as long as you want it to remain thick and to keep growing. So minoxidil acts for just 12 hours. And after that, it's eliminated from your body, like it's out of your bloodstream. So it keeps stimulating, so you have to keep applying. And what it does is, initially when people start using minoxidil, it sort of makes the hair root jump into the resting phase, and then they fall out. Anyway, they get shed, and the next hair that grows starts off again fresh. So some people have that initial hair fall. They feel there's an initial increase in hair fall. And some people say when they stop, they have that, hair fall again. But it's just the normal cycle of the hair that's happening. It's just the growing phase, and then the resting phase, hair will fall out. So again, that's why we say wait 3 to 6 months before you see an effect with minoxidil, because the first 3 months of using it, your hair will still keep shedding, because hair is in the resting phase. There are some hair on your head which is in the resting phase. And then the new cycle will start again after 3 months. So.
Right.
So you have to use it for a long time.
Yeah. Yeah, it's not something people want.
Well, we actually call it female pattern hair loss when it's in women, that's all. So female, actually the thinning of hair in women can have various patterns. You can have just the crown, which becomes thin. You can have a Christmas tree pattern where, there's thinning mainly along the margin, the parting. And and usually the back is always thick. So in females, it is a little different from male pattern. It's okay to use, but the best is coconut oil, because it's said to actually penetrate a little more and help the cuticle. The other oils may feel heavy. It may not really wash off easily. Others don't have any added benefit. Coconut oil has shown in some studies to have to actually make it smoother and better.
Right.
It's not going into your scalp after all. Yeah, you have to remember it's not going into the scalp. It's just for the hair. Yeah. Smart question. So oral minoxidil, the tablet minoxidil was given for hypertension. That's how they discovered. As a side effect, they started getting hair growth. So the amount we're giving it in, it's 1 ml that you have to use on your scalp. That will not lower your blood pressure. So you can use it. Okay, yes. So your thinning of hair, first of all, could be age related also, because with age we gradually the hair gradually thins out. You may not have any thyroid issue, but female pattern hair loss is usually genetic, has a genetic basis. So the front of your head, the front portion of your scalp will usually thin out, like you've said. That's what usually happens first. So so you may just need to visit a dermatologist and get a treatment which is minoxidil and maybe a vitamin supplement. That's all you would probably need. Don't expect your hair to become thick like it was originally. That will never happen. Because again, due to age, we have these limitations. But it can reduce the hair fall, maybe just stabilize it.
Okay, thank you so much. I was thinking of visiting the thyroid doctor. Is it okay?
You can get a general set of blood tests done if you haven't already, because you must get your cholesterol, your thyroid, your blood sugars checked. And then you can take those reports and visit a hormone specialist or a physician also. Or if you want, go to him, let him prescribe what blood tests need to be done and do that, show him the reports. Yes, you must do that. Yeah.
Okay, thank you so much.
Welcome.
No problem. Thanks for asking.
There may be add-on treatments, but without minoxidil, without your basics, it's not going to help. No. We can give topical retinoids. So retinoids tend to peel the skin. So when you use that over months, they may help reduce. It may not disappear again. It's hormonal related. So it just makes the keratin become thick and look like dots on your skin. So yeah.